What makes our program unique is the amount of critical care that we do. It is far more than the usual program, and the EMS program. There's only one other program like it in the country. The resident response vehicle is a unique aspect of our EMS education. What we strive for in emergency medicine is a good mixture of education as well as the interpersonal stuff. And so what I mean by that is that the residents get along real well with each other, and that they have although they're being educated and it's hard work, they're having a good time doing it. I think the reason someone would want to do their residency here as opposed to someplace else, it has the big town type hospitals, 2 big hospitals, but a kind of a smaller town feel. You're not driving in an hour to work every day, you're not having to pay for parking, that sort of thing. It's nice that the downtown area has the barbecue cook-offs every year, they have the art fair every year, so they enjoy those sort of things. And you have enough things to do to keep them interested, like Miller Auditorium, the theaters up in Schoolcraft, those sort of things. It makes it for a nice place to live and a nice place to get educated.
Just another day at the Borgess Emergency Department. Oh, hey Robbie, what you doing, man?
Hey, how's it going? My name's Robbie. I'm one of the new interns here.
You want to go on a tour?
Let's go on a tour.
Yeah. I'm Emily, one of the current second years. This is our emergency department here at Borgess.
Mm-hmm.
All right, so we're coming through here. Can come down into the doctor's lounge, where we have a private restroom.
Fancy.
Yep. Got a little ER physician office where you can hide your belongings. Continue moving forward. We get a view of our little kitchen, fridge, where you can put things you need. And then we move onward. Hello, sir.
How are you doing?
We're going on a tour for our future applicants.
No, not me.
We have a fast track triage area over there. And then we come on in here and we have some busy working residents. Very good, Kaz. Say hi to all the fans.
Hello.
All right. Unit clerk, charge nurse, everyone working hard. And then we enter a trauma bay. This is what it looks like. This is an example of one. It's one of the smaller ones because the other ones are currently in use. So this is what we got. You got your normal, Broslow cart, other equipment you might need, airway equipment, monitor. This is where some of the fun happens. Lots of people hard at work here. The department is kind of set up in a long rectangle with a couple of hallways that run and cut it into thirds. So we'll just give you an idea of what one of those thirds looks like. Got all private patient rooms here.
Mm-hmm.
This is more like the fast track area. Curtains, though still private, so that's nice.
Our eye room as well.
Eye room, yep. We'll head this way here. And we'll take a sneak peek of one more thing. Behind that locked door is the locked psych unit. We see a lot of psych here at Borgess. Patients will come in, they'll need medical clearance and then to determine placement. So we see a lot of that. One of our lovely crisis screeners heading back there. So that's kind of a brief tour of what the Borgess Emergency Department looks like.
Hey, I'm Dr. Danello. I'm Dr. Nawson, and we're going to give you a tour of Bronson Emergency Department. All right, so we are out here outside of Bronson Emergency Department. This is the patient entrance. We have our EMS entrance here. And right behind you, you will see our helipad where air care comes in and out of. That's a cool perk of this residency. You get to work with air care. So now we'll take you inside.
Bronson is our level 1 trauma center for Southwest Michigan as well as Northern Indiana. We get a lot of burns, we get strokes, we get MIs, semis. So we're going to head back to our trauma bays and medical resuscitation bays. We have about 90,000 visits annually, 60-bed ER. We are always really, really busy. Senior residents tend to see about anywhere from 14 to 20 plus patients a shift on average. So here are 3 trauma bays, A, B, and C. Come on in. It looks pretty much like every other trauma bay you will ever see. We have all the necessary staff This room is also a little special because it has our pediatric cart for our pediatric resuscitations. When you're here in the trauma bay, no matter what, ER gets airway, even for traumas, no one will take that away from you. When you're an intern, we typically do have one of our ER interns doing a trauma resuscitation.
All right, so here we have the different pods. This is pod 1, right down the hall is pod 3. As a resident, you'll be assigned to one of these pods with an attending and then maybe a senior or junior resident, depending on what year you are. So behind me is pod 3. You will spend some time back here. Typically, they put lower acuity patients back here. However, I will say that we have intubated back here. I have admitted patients to the ICU back here. So you really never know what you're going to get. And then down this way, this is a gold team. Usually, this is staffed by an attending. Tends to be lower acuity patients.
Hi everyone, I'm Rachel. I'm a third year resident here at WMU. I am talking to you a little bit today about our MSU 1 program. I'm currently on my MSU 1 elective, so I'm doing 6 24-hour call shifts in 2 weeks. Might sound like a lot, but it's actually quite nice. As you can see, I'm currently at my house. So our MSU 1 program, we have a SUV vehicle and it's got a ton of equipment for us to use in conjunction with our EMS in the county. So Kalamazoo County is a little different that we don't transport any of our cardiac arrests. We either work them in the field and get ROSC and then transport them to the hospital, or we work them in the field and then we call a time of death and have the ME come out. Caveat to that is kids obviously is a little bit of an emotional situation, so we always bring those to the hospital to get the parent support. But otherwise, we're working the codes in the field with the paramedics and the fire department, and we're calling them there or getting ROSC and transporting them. We have a big role in that we are the ones to call the time of death. We also have a portable ultrasound in our vehicle, so we can do quick cardiac ultrasound, see if there's any kind of tamponade physiology, any kind of cardiac movement as we're running the code. So that's very helpful, and the paramedics really like that a lot too. We also have a Kaleidoscope Go to help with intubation in the field if that's necessary, and we have a ton of other equipment for chest tubes and emergency crakes if that's needed. We also do refusal phone calls during the day. So if a patient really doesn't want to come to the emergency department and the paramedics think they should, or they have a question on if they can actually make that decision, they'll give us a call and work on the final decision on that. It's a lot of autonomy. You're not riding with a faculty member, but there's always one on staff that you can call if you ever have any questions. They'll actually text you cases that they might have heard on the radio too, to give you a heads up if they hear something coming in that you might want to go to. We have to go to all the codes in the county, but other than that, unless EMS calls us, we can kind of pick and choose what we want to go to. The MSU 1 program is really unique. There's only 2 programs for residents in the country, ours, and then I believe Pittsburgh is the other. I've seen a lot of more places, particularly in the Midwest with lots of rural areas, have their attending physicians staff something similar. I know there's one at Mercy Health in southern Wisconsin and northern Illinois, so it's a very similar program. What the attendings get to do there is what we get to do as residents. We have training shifts our first year where we ride along with the second and third years, get used to what we'll be doing, how to talk on the radio. We also do a lot of sims to help prepare us for cardiac arrest, peds, drownings. With all the lakes around in Michigan, we do get more drownings than we care to, as well as pediatric codes, particularly infants with co-sleeping. We do have quite a bit of that in our population, unfortunately. We also do events with MSU 1 if there's a big concert, like we had Luke Bryan here last year. Our MSU 1 vehicle will be staffed up there just to give some extra support with all the extra people that influx into the county. I really like it. I did EMS before I came to medical school and residency, so I kind of missed the field work. It's fun to get along with the EMTs. You see them bringing your patients into the ER all the time, and now you get to work with them in the field. They get to know you better. They get to know your style, and you get to know them better, kind of trust their evaluations too for when they bring you patients into the ER. Currently, it is very hot in Michigan in the 90s, so it's kind of nice to be able to relax at home a little bit before calls. But we also get a lot of heat stroke too that we might get called for, and lots of car accidents and boating accidents, as you can imagine too. We get a lot more travelers in the summer. It's a great program. We all like it a lot getting out of the department. We usually do one shift in a regular block, and then if you choose to do an elective, it's 6 shifts during a 2-week period or 12 during the month. Another program that is unique this past few months, we are actually starting a conglomeration with Yellowstone National Park. So if they need any help for medical direction in the park, they actually are going to be calling MSU1 soon for those directions. We have a faculty staff member who actually works out there. He's kind of spearheading it with our EMS fellows, and soon it'll be trickling down to us. So that's kind of a fun program. You can also spend your elective time at Yellowstone if you choose to.